Welcome back to Creating Dementia Solutions. I'm Richard Pyatt. This is a Miles for Memories program. We talk about a number of things related to dementia education, movement, programming, research. We invite you to like the Facebook page for Miles for Memories so you're alerted when these episodes come available. If you've been with us this year, you know we've been focused on the Lancet Commission list, which says, hey, look, these situations are ones in which you may have some control over reducing your risk of dementia. And in some cases, our conversations have been somewhat general, applicable whether dementia is a factor or not. And this particular episode is one of those. We're talking about depression today with Dr. Sean Field, Clinical Director at Summit Point. Hi, Sean.
Hello.
Thanks for being with us today.
Absolutely.
I should mention, Summit Point, of course, the Behavioral Health Authority in Calhoun County. So you are right there helping folks with issues like this, issues of behavioral health, and we thought this would be a source of great knowledge for us, so we appreciate this. When we talk about depression, I think in this particular sense, we're really kind of understanding whether or not someone is actually depressed. I mean, we have opportunities where we might feel down, etc., but how do we know depression is at play?
Yeah, I think there are a number of factors that we want to be able to look at if we're trying to figure out if we're experiencing what might be considered depression. There's a very natural emotion of sadness or feeling sad, experiences of anxiety, which can have overlapping feelings and expressions with how people might perceive how you're doing, how your mood is. But one thing we always like to be mindful of is that sadness is normal. You should experience some amount of sadness. And it really becomes a question for us about depression when we start to see those patterns of behavior occurring for a long period of time. So when we think about the main things that we're identifying in depression, we're looking for things like change in food intake, so appetite, change in sleep patterns, change in your overall mood, or how you feel, thought patterns, sort of ruminating or focusing on negative impressions of yourself. And then you can have more extreme versions or feelings associated with depression, feelings of worthlessness, or thoughts of harming yourself. And so, again, when we're looking at what is depression, for us, the big thing to attend to is, has my lifestyle changed in a notable way? So am I thinking, feeling, and acting differently than I used to? In a way that I'm doing less, I'm experiencing less, and I'm engaging less. And if I'm doing that more days than not, for a period of 2 or more weeks, that really would be the time that we'd say that it's important to go have a discussion with your primary care or reach out to a behavioral health professional to get further evaluation and support.
When you talk about differences in food intake and sleep, we're talking about less food and more sleep, or is it different?
So it really is unique to the individual. And so, again, it's why we really want to focus on not so much that you stop eating or you eat too much. It's more that there's a change from what you typically do. So if your normal diet, maybe it's not a great diet and you're taking in some junk food, but you find that you no longer enjoy those things and you're no longer consuming those kinds of foods, and you're just not finding that activity to be something that you want to continue doing. That's really what you're looking for, is just deviation from what you would normally see from a person. That's going to be a sign that something's going on because you're acting differently than would be expected.
So does diet or sleep affect depression one way or another?
Absolutely, yeah. They have a notable impact on your mood, and so we do know that a lack of diet or a lack of a healthy diet, as well as a lack of exercise or irregular sleep, all of them are indicators or increase the likelihood that you'll experience or demonstrate symptoms of depression. And so one thing that's always encouraged, I'm sure if you've been to your primary care physician recently, they'll tell you have a healthy diet, make sure you're getting the right amount of sleep, and make sure that you're getting that exercise in, because they really do have a bearing on your mood and your overall functioning. And the longer that you experience those levels or unhealthy levels of any of those behaviors, it increases your risk of starting to demonstrate those long-term patterns of what we consider depression.
Well, I don't think it matters much what we're talking about exercise comes up as a good thing and all of that. I used to know someone who struggled with depression, and he would always say, I like to run because it releases the endorphins and I feel better. I think this is what we're talking about, right? I mean, this was 30 years ago, so the purview is probably different, maybe more scientific than it was then. But this point is the same, right? That not only do you derive physical benefits from it, but there are some mental health benefits from it too, yes?
Oh, absolutely, yeah. So the research out there really supports that exercising at least a couple times a week for around 30 minutes. And if you can get outdoors to do that exercise, greatly improve your overall mood and your health. Which of course have that impact on your overall mental health and your presentation, your feelings. And the same with activities around sleeping and eating, having consistency in your dietary intake, making sure that you're getting a balanced, healthy diet. If you're only taking in one type of food source, it can be challenging for your system to adjust. And it can have impact as well on your exercise as well as your sleep patterns if you have an unstable or unhealthy diet.
I want to linger on that sleep thing just a little bit longer. So I think there's a perception that if someone is depressed, they just sleep more or they don't want to get out of bed. And that's true, but that might not always be true.
Correct. It can be true. And it does present in a certain number of individuals that their depression does demonstrate itself as prolonged periods of sleep or inactivity. The inactivity is more what you see. It's not that individuals are sleeping a notable amount of the day. It's their lack of overall engagement in activities that they used to find enjoyable, or activities in their life that you tend to see. So it's not necessarily always sleep. It might be an activity, and people sort of equate the two. But what we do find is that it really is personal, and it can be other dimensions that we tend to see with depression include things like irritability and difficulty in being able to focus and concentrate. And those are actually symptoms and features that you can experience that disrupt your sleep. And so it's actually the case that you might get less sleep than you typically would have. And it still would be the same a group of concern around those symptoms of depression.
Yeah, well, that makes a lot of sense. If something's on your mind, that can keep you awake and thus disrupt that. I've also understood that some people are told you may have depression, and they're surprised by that. Do you see that often? And is that something that's fairly frequent, that someone says, really, I don't know that I'm depressed, but there are signs that are recognized?
Yeah, I think it's not that uncommon with depression or any mental health condition, really. Humans are really, really good at adapting to their life environment and how things are going. And so they're finding a way to get by. And they tend to find strategies or tools that are helping them navigate this moment, but it might not be the long-term, most effective approach to addressing the challenges that they're experiencing or the ways that they're feeling. So it's not shocking when someone comes in and they have a general sense that things aren't where they want them to be, but they wouldn't themselves call it depression. And through the course of that clinical interview, you're able to gather that information and sort of help build that picture and get the impression that, okay, yeah, we are seeing more here than just dispositional sadness. I'm not upset because a thing happened recently, but this has been really a dominating experience for me over the last several weeks and months.
And there's the difference that folks would look for, professionals would look for, is trying to understand that. So let's talk about treatments. We hear about drugs. Is that always necessary?
It is not always necessary. What we do like to encourage individuals to do is to pursue the options that they're comfortable with. And so there are a variety of different approaches that you can take to addressing mental health conditions, specifically depression. Some of that includes drugs or pharmacological intervention that can be done either through your primary care or a psychiatrist at a place such as Summit Point, where those are almost always done as an additional intervention to the recommendations of those prescribers to also have that individual seek out engagement with a therapist. So there are a lot of different programs out there in different modalities for how you can approach depression for those outpatient type contacts. And then there are also just general resources available to you. So one of the resources that we have at Summit Point is a program called Credible Mind, where it doesn't always have to be that in order to get my depression addressed, I have to only go to a therapist or a psychiatrist to receive those supports. We encourage people heavily to use natural supports or tools or resources in their community. Incredible Mind is one of those where it can help you find information, get educated on what depression is, and even help you access different tools and resources around self-help that you might use in conjunction with seeking out the supports of those professionals.
So a sort of an in tandem approach over which a person has some control on their own.
Absolutely, yeah. We really do find that the most effective approaches to therapeutic intervention are ones that are aligned with the wishes of the individual, and doing that work together with them as opposed to a presupposed path of care that they have to go through.
Talk about the intent of having a therapist and what the path should be and why you advocate for that.
So I think one of the greatest benefits that can come out of engaging with a therapist, in addition to those other interventions, is it's a person that has been trained in helping you understand your thought patterns and identify the different behaviors that are contributing to the challenges that you're experiencing. It's not necessarily the person that's going to have the answer to every question, but think of them as a helpful guide that walks you through your path of finding the answers to your question. Therapists are just really capable in helping individuals navigate those difficult questions that they're going to ask themselves, as well as finding strategies and techniques that will be effective in their personal life, so that it's really tailored to support that person, again, not just to support the others that are around them.
And of course, we ourselves are not trained, most of us anyway, are not trained in behavioral health ourselves, so trying to sort it out alone is probably unrealistic. Right?
Yeah, I think it can be challenging, and a lot of times you might hear people have intuitive solutions to depression, such as things like, well, if you were just busier, if you just did more, it would all go away. And really, that's not necessarily always the case. It is possible that those actions would have a meaningful impact. But again, that's really the purpose of being able to engage with a psychiatrist or with a therapist, is they'll help you understand and explore some of the causes or factors that might have brought about these experiences, and build those long-lasting solutions that will be meaningful to you, even if you were to experience those symptoms again. The tools and strategies they teach, you should have ready and available to you for that next instance.
I know someone, he's one of the smartest people I know, but when it comes to therapy, he says, no, I don't want to talk to a stranger about my problems. You probably hear this, and it's probably fairly common. What do you say to folks who feel that way?
You know, I think it's a fair thing to voice, and it's something that they should have the right to express, and that is really one of the goals of engaging with people is meeting them where they're at and their readiness to seek treatment and readiness to seek care. It's one of the reasons I'm cautious to ever say you must go and see a medical provider or you must go see a therapist. Is it really is about where are they at and their understanding of their need, and where is it at in their desire for change. It is possible that you are experiencing symptoms of depression, but you're not ready yet for that change. The biggest and the best thing you can do is continue to be there to support that person, and the second that they indicate that they are ready, make it as easy as possible for them to begin that journey.
Can depression be prevented? I think we perceive it as something that something happens and it causes us to be depressed, which would seem that we don't have the ability to stop some of those things, but we might have ability to prevent depression?
Yeah, it's a very complex question, and the actual cause of any episode of depression or any instance of depression is very difficult to pin down to one cause or one factor. What we do know is that there are means and prevention approaches that decrease the likelihood that you will experience depression. And some of those align with the very things we've talked about already today. Having a healthy diet, healthy exercise, and getting out there and doing those activities, getting regular healthy sleep. And then one dimension I didn't cover as much earlier on was ensuring that you have rich connections socially. Now, I think one thing that people often confuse that piece with being is I must be very social and be out and about all the time. And it's not the case that I'm necessarily recommending that you have to be out every day hanging out with people. But the important piece for us to focus on and attend to around communication is that we have individuals that we engage with. That can be through any number of formats, whether they be virtual or in person, or even just a very close-knit group of 3 or 4 individuals that you are spending that time with. Having those social relationships, those social connections are also very protective in terms of reducing your likelihood of experiencing depression. One of the additional benefits is that if you do happen to do all those things, it's not to say that you will never experience depression. It's still possible. And having that friendship and that connection and relationship with individuals, those are the individuals that can lean in and support you. And if you're struggling in making that decision or that commitment to move forward with seeking treatment, they can often be a really nice resource to help navigate those different decisions in your life.
Before we go, we should talk about how to seek help quickly here. I suppose really the forefront way to do that is to reach out to a professional or come to, say, First Step, for example.
Absolutely. I think there's the goal with mental health, and the goal that we've had for several years in the behavioral health community is that there has to be no wrong point of access. So if you need behavioral health, you should be able to ask for help anywhere and be directed effectively. So we've worked really closely with different partners in our community. So if you go to any of your primary care offices and you express needs, they know Summit Point is a resource that they can connect you with, among others as well. But if you're ever wanting to seek resources, you can go through Credible Mind. That will give you access to resources. You can do self-assessments to help get a feeling or a measure of if you might be experiencing symptoms of depression. And if it does recommend that you should follow up with a therapist, you can actually connect right there through Credible Mind to Summit Point. You can, of course, go to our location at 175 College Street, the First Step program. It is 24/7, barrier-free. So if you're ever unsure, you just want to even explore the question of, do I have any challenges, or is there anything I can get help with? Our answer to everybody is come in. We'll figure it out together while you get there. And so I think those are key and easy resources. Just reach out, ask the question, and one of the goals that we've had over the last few years, as I said, is to make sure that any door that you open, you should be able to get your way over to us.
And that's where we'll leave it. 175 College Street, by the way, is where First Step is, once again. Thank you, Dr. Sean Field, Clinical Director at Summit Point. In fact, Dr. Field will be with us in our next episode as well, where we try to draw some correlations between depression and dementia, and we'll get to that. Meanwhile, Mouse for Memories on Facebook. Like that page so you know when these episodes come available. I'm Richard Pyatt. Thanks for being with us.